Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. So currently we are working with a client who has their 79-year-old dad in ICU with COVID pneumonia/COVID ARDS, and he's on high flow nasal prongs or high flow nasal cannula, and he's on 70 to 80% of FiO2. So that's a tricky situation because the challenge here is to keep this gentleman off the ventilator and off intubation, right? And what we suggested to the client is that he's on Precedex, which is a sedative. Sedative should only really be used for patients that are intubated and need to be in an induced coma, because the less awake this gentleman is, the higher chances he needs intubation. So we asked the client to start pushing back and saying to stop the Precedex, because again, Precedex should not be used for someone that can breathe independently. And she pushed back and they stopped the Precedex, and then all of a sudden he started to wake up and his respiratory function apparently improved. Furthermore, he has not had any nutrition for about 5 days, and that is medical negligence. That is basically starving someone to death. And we asked the client to advocate for TPN. TPN stands for Total Parenteral Nutrition, also known as IV or intravenous nutrition. And then the ICU team said to her that TPN is no longer in use and that it's old-fashioned. Well, in 2023, as far as I'm aware, TPN is still used for ICU patients, for other patients with gastric problems, with digestive problems. With intensive care at home, we're looking after TPN clients at home. So the whole notion of TPN is no longer in use and is old-fashioned, it makes me laugh. It's a joke, really. Again, what does it come back to here? It comes back to that the biggest challenge for families in intensive care is simply that they don't know what they don't know. They do not know what questions to ask. They do not know what to look for. And they don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So by working with us one-to-one, this client all of a sudden has power, has leverage, knows what questions to ask, knows what to advocate for. And it gives her a whole different perspective, because so far it's only been doom and gloom from the intensive care team saying, well, he needs to be intubated, he needs this, he needs that, he won't survive. They tried to force her to sign a DNR, which initially she did, but we encouraged the client to challenge the DNR, and now the DNR is off. With our help, this client really got tremendous results, and her father gets a second chance at life. He probably would have passed away by now. The intensive care team would have probably stopped everything, and he would have probably been dead by now. Let's call it for what it is. So if you have a loved one in intensive care, go to IntensiveCareHotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@IntensiveCareHotline.com. Also, have a look at our membership for families in intensive care at IntensiveCareSupport.org. There you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care and intensive care at home related. Also, if you need a medical record review, please contact us as well. We review medical records for patients that are in ICU. We review them in real time, which is what we're exactly doing for the case that I've just shared, for the case study for this particular client. So we're reviewing medical records in real time, and we can advise the client in real time what it all means, what questions she should be asking, and so forth. But we also review medical records after intensive care, especially if you're suspecting medical negligence. So that's my quick tip for today. Like the video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the notification bell, share the video with your friends and families, and comment below what questions and insights you have from this video or what you want to see next. Thanks for watching. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll talk to you in a few days.